Welcome back to our channel. Frequent bathroom trips every couple of hours can be normal for some individuals, especially with high fluid intake. However, if this occurs consistently, causes discomfort, or disrupts your daily routine, it is advisable to investigate the underlying cause. This condition, known scientifically as frequent urination, may sometimes be accompanied by kidney pain. Patients often describe this pain as a burning, stinging, or itching sensation. Frequent urination can be associated with various issues involving the kidneys, bladder, prostate, or vagina. It is important to take these symptoms seriously, as they can indicate significant health concerns if left untreated. In this video, we will explore the various reasons for frequent urination, whether or not you experience pain. We'll also discuss when it is essential to seek medical advice to help you make informed decisions about your health. Don't miss the second half of this video, where we share effective home remedies and treatments for managing frequent urination. Stay tuned until the end to learn about key foods that can make a significant difference. Causes of frequent urination. Needing to urinate every 2 hours can be normal for some people, especially as they age. It is common to wake up occasionally during the night to urinate. For example, in your 40s and 50s, waking up once a night is typical. In your 60s and 70s, it might be twice a night. In your 80s and beyond, it could be 2 to 3 times a night. However, waking up too often at night to urinate, known as nocturia, can disrupt your sleep and may indicate health issues, such as heart disease, sleep disorders, or swelling. Sometimes, frequent urination is accompanied by kidney pain, often described as a dull ache in the back, stomach area, or sides. This pain can signal underlying kidney issues that require medical attention. Kidney pain can result from various diseases, many of which also cause frequent urination or a constant urge to urinate. However, if you experience pain along with frequent urination, the issue may not always be kidney-related. Pain at the start or during urination typically points to a urethral issue, while pain after urination often suggests problems with the bladder or prostate. These issues can be associated with kidney pain due to the close proximity of the bladder, prostate, and urethra to the kidney. There are multiple reasons for frequent urination, which can be related to kidney or bladder problems or other non-renal diseases. Understanding these causes is essential for addressing the symptoms effectively. Now let's explore the possible causes of frequent urination. 1. Urinary tract infections, UTIs. The urinary tract is the pathway from the kidneys to the urethra that moves urine from the inside to the outside of the body. It starts in the kidneys, where urine is formed, then passes through the ureters to the bladder where it's stored. Finally, urine is expelled from the body through the urethra. Infection of any part of the urinary tract is one of the most common reasons for frequent urination, and is often associated with pain. This can include kidney infections, pyelonephritis, bladder infections, cystitis, and urethra infections, urethritis. Infections lead to inflammation, which can irritate the lining of the urinary tract and cause a greater urge to urinate. To flush out the bacteria causing the infection, your body may also increase urine production. Other symptoms of UTIs include pain in the groin or lower abdomen, bloody or cloudy urine, pain while passing urine, dysuria, nausea, fever, or chills. Are you enjoying our video so far? If so, please give us a like, and we'll continue to create more content like this. Let's delve into the potential causes of frequent urination. 2. Kidney diseases. If you find yourself needing to urinate more often, particularly at night, a condition known as nocturia, this may indicate an issue with your kidney's filtration system. The kidneys serve as the body's natural filters, removing waste and excess fluids by producing urine. Under normal circumstances, the kidneys concentrate urine by reabsorbing water back into the bloodstream. However, if the kidneys are damaged, their ability to concentrate urine diminishes, resulting in the production of larger volumes of dilute urine. This increased urine volume leads to more frequent urination. 3. Bladder issues. Frequent urination can also stem from problems with the bladder. One common issue is the presence of bladder stones, which can cause symptoms such as difficulty urinating, pain during urination, and lower abdominal pain. These symptoms can prevent you from fully emptying your bladder, leading to a frequent urge to urinate. Another concerning issue is bladder pain syndrome, also known as interstitial cystitis, a chronic condition characterized by ongoing pain in the lower abdomen and frequent urination. The exact cause of this condition is not fully understood, but may involve an immune system defect similar to autoimmune disorders or allergic reactions. Sometimes, frequent urination can indicate more severe issues, such as bladder cancer, which can also present with lower abdominal or back pain and blood in the urine. 4. Urethral stricture. The urethra, responsible for draining urine out of the body, can sometimes become narrow due to injuries or infections, a condition known as urethral stricture. This narrowing can make urination difficult, often causing the need to urinate repeatedly because it is challenging to pass all the urine in one go. The following causes might not be directly related to urinary tract conditions, but they can still be common and concerning. 5. Prostate problems. In men, another common reason for frequent urination is benign prostatic hyperplasia, BPH, an enlargement of the prostate gland located just below the bladder. This gland plays a role in producing semen, the fluid containing sperm. As men age, it is common for the prostate to enlarge, leading to urinary symptoms such as increased frequency of urination and difficulty controlling or retaining urine. An enlarged prostate can obstruct the flow of urine from the bladder, causing incomplete emptying and frequent urination. Additionally, a prostate infection known as prostatitis can cause frequent and painful urination. Let's examine 2 more possible causes of frequent urination. 6. Vaginal issues. Infections in the urinary tract or prostate can lead to more frequent trips to the bathroom. Similarly, vaginal infections, also known as vaginitis, whether caused by bacteria or yeast, can also increase the need to urinate. Another possible cause is anterior vaginal prolapse, also known as cystocele. This condition occurs when the bladder drops from its normal position and pushes against the front wall of the vagina. This displacement happens because the pelvic floor muscles, which support the bladder and other pelvic organs, become weakened or stretched. As a result, the bladder is not fully supported, leading to a sensation of needing to urinate more often. Common reasons for pelvic floor weakness and bladder displacement include chronic constipation, multiple childbirths, and heavy weightlifting. In addition to causing frequent urination, cystoceles can also lead to pressure symptoms in the pelvis. 7. Pregnancy. During pregnancy, as the baby grows, the uterus expands to accommodate the developing fetus. The bladder, which sits below the uterus, gets pressed upon by the growing uterus, taking up more space. This pressure reduces the bladder's capacity to hold urine, resulting in an increased frequency of urination. 8. Neurological disorders. Our nervous system comprises a network of nerves that regulate bladder function. These nerves typically facilitate communication between the bladder, spinal cord, and brain, instructing the bladder muscles to contract or relax to store or release urine. However, conditions such as neurological disorders, stroke, and spinal cord injuries can disrupt these nerves. This disruption often results in frequent urination and a loss of control over the ability to hold urine. 9. Diabetes. Diabetes is a chronic condition characterized by an excess of glucose in the bloodstream. The kidneys play a crucial role in filtering blood, so when there is too much glucose, they must work harder to filter it out and excrete it through urine. This is why individuals with type 1 and type 2 diabetes often experience more frequent urination. Additionally, diabetes is a major cause of kidney damage. High blood sugar can harm the small blood vessels in the kidneys, impairing their ability to filter properly. As previously mentioned, kidney damage is a common cause of increased urgency to urinate. 10. Medications. Certain medications can increase urine output. Diuretics, which are used to treat conditions like fluid retention or swelling, are a prime example. These drugs help the kidneys remove excess water and salt from the body through urine, leading to more frequent urination. Additionally, some common medications can impact kidney health, including anti-inflammatory drugs, antibiotics, and proton pump inhibitors, PPIs, for acid reflux. 11. Fluid intake. After intense physical activity, a sauna session, or a hot day, you might find yourself drinking more than usual. This can lead to increased urination, which is simply your body's way of balancing fluid intake and output. Additionally, beverages containing alcohol and caffeine can also increase urination frequency. However, there is no precise threshold at which these drinks start affecting urinary frequency. When to see your doctor. While frequent urination is not always a cause for concern, certain symptoms warrant medical attention. If frequent urination is accompanied by a high fever and chills, it could indicate an infection, and you should seek medical help. Other concerning symptoms include one-sided pain, lower abdominal or back pain, painful urination, dysuria, or blood in your urine, hematuria. Additionally, if you notice a vaginal or penile discharge, especially if it resembles pus, consult your doctor immediately. Some may wonder if urine color can help diagnose kidney disease. Generally, damaged kidneys do not change urine color significantly. However, frothy or foamy urine, which indicates the presence of protein, can be an early symptom of kidney disease. Other than this, kidney failure does not typically alter urine color. If you cannot identify a reason for increased urination, such as changes in fluid intake or consumption of alcohol and caffeine, it's advisable to consult your doctor, especially if it's affecting your sleep. During your visit, your doctor will inquire about your fluid intake, medications, drinking habits, swelling in your feet, duration of symptoms, and associated symptoms like burning or pain when urinating. They may also ask about your history of fevers and whether you snore. Preparing these details beforehand can help your doctor diagnose your condition more effectively. Possible treatments for frequent urination. Once your doctor diagnoses the underlying cause of frequent urination, they will discuss potential treatment options with you. The treatment will depend on the specific cause. For instance, urinary tract infections, UTIs, are typically treated with antibiotics, and as the infection clears, your urination frequency should normalize. Since antibiotics can affect kidney function, it's crucial to discuss the appropriate dosage with your doctor and focus on eating kidney-friendly foods, which will be mentioned later in this video. If bladder pain syndrome is causing your frequent trips to the bathroom, consider adopting healthy lifestyle changes such as stress reduction, dietary adjustments, exercise, and bladder retraining techniques. Bladder cancer and urethral stricture, however, require expert medical evaluation and may often involve surgical intervention. Benign prostatic hyperplasia, BPH, can typically be managed with medications that alleviate obstruction, though in more severe cases, surgical removal of enlarged prostatic tissue may be necessary. For those with diabetes, managing glucose intake is crucial to address frequent urination. For anterior vaginal prolapse, Kegel exercises or other pelvic floor exercises can be beneficial. Similarly, during pregnancy, Frequent urination can be managed with pelvic floor exercises, increased fiber intake, and limiting fluid intake after dinner. Before starting any treatment, remember that modifying your fluid intake and tracking the types of beverages you consume can also help manage and reduce frequent urination. Home remedies for frequent urination. When addressing frequent urination, there are limited home remedies available, particularly if the cause is related to underlying medical conditions. However, if your frequent urination is linked to your drinking habits, keeping a diary to track your urination frequency can help identify the cause. While it's essential to consult your doctor, some home remedies can support your treatment if you have any of the conditions mentioned earlier. First, reduce the intake of caffeinated drinks, alcohol, and sodas. Additionally, avoid drinking water a few hours before bedtime to minimize late-night bathroom trips. Bladder retraining techniques, which involve gradually holding urine for increasing intervals, can help build bladder capacity. Pelvic floor exercises, especially beneficial for elderly women, can strengthen bladder muscles and improve holding capacity. For frequent urination due to a urinary tract infection, UTI, some simple home remedies include increasing garlic intake, drinking cranberry juice, and consuming probiotics, although more research is needed in this area. Avoiding citrus and acidic foods can also help, as these may irritate the bladder if you have an infection. Preventing kidney diseases. Preventing kidney disease largely involves making healthy lifestyle choices. Regular physical activity is crucial, so aim for at least 30 minutes of exercise per day. If you are obese or overweight, focus on losing weight to reduce the risk of kidney disease and other health issues. If you smoke or drink alcohol, try to cut back or quit altogether. Women should limit alcohol to 1 drink per day and men to 2 drinks per day. Seek help if you have difficulty quitting smoking. Managing existing health conditions, such as hypertension and diabetes, is also vital. High blood pressure, above 120/80 mmHg, is a common cause of kidney damage. Regularly check your blood pressure and seek medical attention if it is elevated. To prevent high blood pressure, reduce salt intake, exercise regularly, and make dietary changes. Similarly, managing blood sugar levels is essential since diabetes significantly affects kidney health. Adhere to your diabetes medications, adopt lifestyle modifications, and monitor your blood sugar regularly to protect your kidneys from disease. It is best to avoid the excessive use of over-the-counter painkillers, such as NSAIDs, as they can damage the blood vessels in the kidneys. Use these medications cautiously and consult your doctor regarding the appropriate dosage for your specific condition or pain management needs. A diet that protects both your heart and kidneys includes fresh fruits and vegetables, whole grains, and fat-free dairy products. Aim to keep added sugars to less than 10% of your daily caloric intake and limit sodium intake to less than 2.3 grams per day. You can use spices as a substitute for salt to enhance the flavor of your food and choose to bake or broil meats instead of frying them. Water is the best drink for your kidneys. It has 0 calories and is essential for hydration and the normal functioning of the body. To stay hydrated, prefer water over other beverages, especially if you are at risk of developing kidney disease. In this video, you learned that frequent urination can result from both renal and non-renal diseases. Key causes of increased urination frequency include urinary tract infections, UTI, benign prostatic hyperplasia, BPH, bladder stones, urethral stricture, bladder cancer, diabetes, pregnancy, vaginal prolapse, and increased water intake. It is important to consult your doctor if you experience frequent urination accompanied by blood in the urine, lower abdominal pain, fever, chills, or vomiting. The treatment for frequent urination depends on its underlying cause, such as antibiotics for UTIs and surgical intervention for cancer or urethral strictures. Home remedies for managing frequent urination include fluid modification, bladder retraining techniques, pelvic floor exercises, and avoiding citrus foods. Dietary changes, regular exercise, controlling blood pressure and blood sugar levels, and avoiding excessive use of painkillers can all help prevent kidney disease. We would like to extend our heartfelt gratitude to all our current subscribers and viewers. Your support motivates us to continue sharing valuable content. Don't forget to hit the bell icon and turn on all notifications so you never miss a life-saving video. If you are suffering from kidney disease, it's crucial to modify your diet to help mitigate the damage. Recommended foods include strawberries, red bell peppers, low-phosphorus cheese, pomegranates, blueberries, avocados, tofu, fish, root vegetables, broccoli, and beans. For more details, you can watch the video on the screen